Thank you for joining today's Aligned Modern Health Digital Doc conversation on men's health. Before we get started, we'd just like to introduce a little bit about who Aligned Modern Health is and what we offer, just in case it's your first time joining the Digital Doc webinar series. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, offering support for the whole body, both internal and external medicine. Our treatment plans at Aligned Modern Health aim to get to the root cause of why you're feeling what you're feeling and not just put a Band-Aid on any symptoms or conditions you may be experiencing. We are in network with most major insurance providers, and we offer 18 clinic locations throughout the Chicagoland area, as well as telemedicine in 8 US states. Each of our physical clinic locations are supported by several core services, including our physical medicine practice, which offers chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. We also offer functional medicine and clinical nutrition, which we like to say is a really great way to look internally to better understand why you're feeling what you're feeling externally. So we treat a lot of gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, men's and women's health, testing for food sensitivities, offering nutritional counseling, a really great whole person practice. We round out our services with an acupuncture practice that is supported by acupuncture, but also some other modalities under the traditional Chinese medicine umbrella like herbal medicine, cupping, moxibustion. Acupuncture can be really beneficial for physical pain symptoms, but also to treat some intangibles like stress, anxiety, and depression, sleeplessness, seasonal allergies, men's and women's health and hormone balancing, pregnancy and fertility support. So acupuncture can be a really amazing, beneficial practice to a lot of different things, both physical and a little bit more intangible. Going back to today's conversation on men's health, it is my pleasure to welcome both Dr. Ryan Duro, functional medicine provider, and Dr. Jonathan Kalin, licensed acupuncturist, here today with us. Welcome, Dr. Duro.
Thanks, Janine. And thanks for everybody for joining us here today. We appreciate you taking the time. We put together these type of events to just kind of introduce key elements to move your health journey forward. I mean, we want usable takeaways that you get from us just having this conversation today. So you can see my bio there. Feel free to read. I think it'd make probably more sense to just kind of talk a little bit more about functional medicine. Janine did a good job. And then we'll, again, let John hop into it, or Dr. Kalin here. So functional medicine, best way I can explain it is trying to get to the root cause as to what's going on. Sounds simple when we say that, but it's really looking for any imbalances going on within the body. Is there too much of something? Is there too little something? Very rarely is it just one silver bullet, right? So it's basically having a relationship with the patient as a team, just kind of going along that health journey and saying, hey, like, what are we missing? What's been going on over the course of time that's led to why there's a symptom, why there's a roadblock as to what's going on here. So, and that'll become more apparent as we have our conversation today as to like what the examples of those things would be. So yeah, I'll pass it on to Dr. Kalin, and then we'll get going after that.
Hi, thanks Dr. Ryan, and thanks Janine, and thank you everybody for making it in today. My name is Dr. Kalin. I'm a licensed acupuncturist here at Aligned. I do a little bit of everything here. Do some cross training in chiropractic, massage, physical medicine as well. And one of the things I like about Aligned is we kind of align a lot of our values together and honestly work together to find these root causes. And one methodology may work, one methodology may not. And kind of the whole idea is we kind of partner to, again, find those root causes to help you out. Really, the biggest question a lot of people have, acupuncture, how does it work? Just to give you a little bit of snippet is think of the body kind of like you would a battery. It's both has chemical and electrical components. And kind of the idea is to kind of rebalance a lot of these kinds of factors. Just like you would change your oil or change the spark plugs, things kind of get out of balance, or you'll have inflammation, that's like corrosion on a battery. And the idea is to get things in this balanced state and everything kind of functions a little bit better.
Wonderful. Thank you both so much for being here. I'd love to turn the conversation over to you now for your discussion on men's health.
Cool. All right, so yeah, I'll just kind of jump into it here, and then we'll work through there. So I want to start just kind of with a little disclaimer, on testosterone. We can't talk about men's health without talking about testosterone, specifically low testosterone. That's something that most people think about when we're thinking of men's health or symptoms associated with declining men's health. And testosterone is one of those things that does peak when we're 25. So a lot of us don't know what those values are. So keeping that in mind as we're trying to troubleshoot as to what's going on with like I said, what's making us feel unwell. But it is very, very possible if your testosterone is low to get your own testosterone back. Again, not to say it's one simple thing, but that is something that does need to be stressed. And I definitely want as a key takeaway from our conversation today, because testosterone replacement, well, hormone replacement in general has become very popular. And it is something that is warranted. There's a lot of benefit to it for a lot of people, but doesn't mean that it's always warranted. And it doesn't mean that that's always the solution. And it doesn't always mean that more testosterone is better, because as you'll see as we talk about it, sometimes too much of one thing, especially testosterone, can look like anger, can look like rage, can look like overconversion to other hormones, leading to other symptoms. So these are just things that need to be paid attention to, and we always have to be asking why. Very rarely is it just like one simple thing. So before we jump into just symptoms that we commonly see, I don't know if Dr. Kalin, you had any other insight into that before we jump in here.
No, I think you've got it pretty well covered today.
Okay, cool. So yeah, so I'll just start listing a couple common symptoms that I see in practice, and then you can feel free to interrupt me or jump in, or I'll take a break here. So some of the more common ones that I'll have patients present with is some, low motivation, groggy, loss of interest, feeling that their mood's been low, feeling that people in their life have been telling them that their mood is low, that they're a little bit more grumpy than they used to be. A very common one that I'll see is low libido, inability to achieve an erection, inability to achieve an orgasm, increased breast tissue. Obviously that can be deconditioning, but that is something that a lot of men will present with, or a side symptom that they'll kind of talk about. And like I said, yes, that can be a deconditioning thing, but that also can be a hormonal imbalance. That's a very common symptom of a process called aromatization, when testosterone overconverts to estrogen. And males and females have all the same hormones in their body, but like men need more of some, females need more of some, and estrogen is not something that we want to be overconverting to in the male body. Prostate enlargement, obviously diagnosis of that, patients usually are coming in for kind of have an idea, and that's usually again another overconversion of testosterone to a hormone called DHT. And then I'd say one of the bigger ones too can be decreased strength, inability to put on muscle mass, people that used to be athletes getting back into exercise routines, realizing that they can't put on the muscle mass that they had before, or they're not recovering from the same type of exercise that they did before, or that there used to be weekend warriors. They could knock out a lot of stuff on the weekend, recover during the week, and be good to go by the following weekend, and now noticing that they can't do that anymore. So yeah, I'd say that's some of the more common ones that I see. Anything did I miss anything, Dr. Kalin?
No, you kind of got it covered. And also to stress, there's quite a lot of things that can cause these symptoms that are just low T as well. And again, that's
Absolutely.
one of the benefits of getting a lot of that ruled out. You've got stress and other types of pathological factors, which we'll kind of touch base on a little bit as well. All those can be kind of draining on your reserves and a lot of these other, extraneous factors as well.
Yep. Yeah, absolutely. So I think, jumping into common causes now makes a lot of sense. And I'll again just kind of go over a list of thoughts I've put together of common causes for hormonal imbalances, symptoms, and good point. It's not that low testosterone is always what is part of those variables. And that's what we want to try to talk about today, is there's a lot of variables that can play into what makes an individual feel unwell. So one of the top ones I'd say, chronic inflammation. I mean, we hear about it now a lot in the sense of inflammation being the root cause of disease, causing this, causing that, and things that we can take to suppress the inflammation, which is great. But, as we keep talking about these root cause factors, like inflammation, at least in my opinion, is not a root cause driver, right? Like there's usually something else driving the inflammation. Is it not enough antioxidants in our diet? Is it not enough sleep? Is it toxins we've built up from our environment. I mean, it is one of those things that doing a little detective work in that fashion can be very beneficial. And there's not one best way to quote unquote like diagnose inflammation, but I'd say some of the is if we're looking for, well, subjective data might be feeling achy. That could be a cause of brain fog. That could be a cause of skin manifestations. But a good objective marker, usually what I'll recommend to people if they're going to get their blood work done with their primary care doctors at least once a year through a marker known as CRP on there. That's a very high sensitivity marker for just systemic inflammation in the blood. So it at least gives you clues. But another cause is not moving your body enough. Again, like exercise is key for overall health, and it doesn't have to be one way, shape, or form. Doesn't have to be high intensity. You don't have to be doing any specific one thing, but like movement is key. Stress, you'll hear us talk about this countless times on the webinar today. I mean, stress looks like a lot of things, and causes of stress look like a lot of things, but physiologically, what happens from a stress standpoint, especially if we're talking about testosterone, is physiologically our cortisol levels will shoot up, and cortisol is our stress hormone. Cortisol is a great hormone, but cortisol, if it's out of balance, can wreak some havoc on the body, plus depleting our testosterone. If I were to say what I thought the top cause for most of my patients was in practice, it would be for low testosterone, it would be elevated cortisol. I just see that quite a bit on testing. Insufficient sleep, I think, would go hand in hand. That's when our body's meant to regenerate. Nutrient deficiencies, I see quite a bit play into it. Toxicity issues, that's a big one. It's just building up anything from our environment, be it mold, parabens, pesticides. I mean, we leave the house, I think, exposed to over 200 chemicals every single day. Obviously, some of us less, some of us more, but just with everything we're putting on our body and everything that we're eating. Crazy diet swinging in one direction cause, and like I said, not eating enough antioxidants. So I think that's some of the top ones that I see. And again, probably missed them in there. What about you, Dr. Gale?
Yeah, no worries. Yeah, really, again, the bigger thing is not only do you have these bad things that happen, it's what can we do to fix that? And a lot of that kind of comes down to, again, basic things like sleep. What are you putting into your body? What are you doing with your body? Again, it's like a car. Like it needs fuel to function, and then it needs to actually be able to communicate to itself. That's a lot of your hormones, and then your sleep. That also is what allows everything to function properly and recharge. And oftentimes, sleep issues, again, relate to a lot of these other problems like high blood pressure, cardiac issues, brain fog, low mood. Oftentimes, like if like our partner is nudging us saying, hey, you're snoring, I mean, that's a good chance to go, hey, maybe I should get that ruled out for sleep apnea. It's incredibly underdiagnosed.
Yeah, absolutely. Yeah, so again, I think the majority of our conversation now proceed of just like, what do we do in our specific medicines? What is kind of treatment look like? Things that we're looking for. And we both chatted yesterday about something that we wanted to make sure kind of came across in this webinar is basically just the importance of foundation. So we will spend, a good amount of time talking about that, and then we can kind of talk a little bit more about specifics for different conditions, and then we'll open it up for questions after that. But before I jump into that, I just do want to stress with, an important part of a health journey can be testing. That is something that's not always required. That's not something that is the only way one can get help. But if, one has not been feeling great for a long time, testing can start being very insightful to just say, hey, like, what are some of these factors, right? Like if we're inflamed, if we're not feeling good, if we just have brain fog, if we just don't feel as energized as we would before, and it's been years and it's just not getting better, like things we need to take a look at our labs, right? Like just what are some foundational markers look like? Are we running low in nutrients? Do we have too high of cortisol? Do we have too low of testosterone? Do we have things like heavy metals or gut-based issues? I mean, these are things, again, that can be tested and can start giving puzzle pieces towards how we put the body together. Because like I said, root cause is very rarely just one thing, but always we are starting with a good foundation. I mean, it is very hard to heal the body if we're not doing kind of those consistent routine things that are needed for overall health. So in my opinion, what those would be is a good foundational diet, right? Like there's not one perfect diet. There's not one perfect diet that one person should follow. It is kind of confusing out there with all the data, but I do always compare it to the longest lived populations on earth. Like what types of foods were they eating? And the common thing between a lot of those is they're eating a lot of colors, right? Like they're eating a lot of antioxidants, they're drinking water, they're moving their body, they're eating enough protein and fat, but not too much of those things. They're eating more like the anti-inflammatory versions of these things. Exercise, we talked about it, got to be moving, especially if our goal is boosting testosterone naturally. Putting muscle mass on our body is going to be the one thing. And again, it doesn't have to be exercise you hate, but it does have to be things that do build muscle mass, specifically in our legs. Like that's where 60% of our muscle mass is, from like our butt to our knee. And if we're not doing squats and deadlifts and Romanian deadlifts and step ups and things along those lines, like it's very, very difficult. And it also is just part of longevity. We lose, I think it is 5 pounds of muscle mass per decade after kind of like our 30s. I mean, if we're trying to get back to where we used to be in our 50s and we haven't been exercising, we could be down 10, 15 pounds. So very, very difficult to get that back. Not that it's impossible. It's very, very possible to do a lot of these things, but keeping up with it, prevention is always key. Sleep, I mean, we talked about that already, but that is when our body heals, regenerizes. I mean, detoxifies, brain heals, detoxifies, same thing. And then stress, again, we'll always come back to it, but we need to figure out ways to turn off our nervous system if it's always on the go. Like if we can't fall asleep at night, if we're frequently waking, if we're feeling anxious, if we're feeling wound, if we feel tired and wired, like these are things we just need to figure out. And again, before I jump into like specific things that I'll usually do from a functional medicine standpoint, Dr. Kalin, I'll let you kind of go on that because I know foundation is a big part of what you do in practice as well.
Yeah, absolutely. And again, that's kind of the root cause, root solution to all of life's problems. And really when it kind of comes to it, and why a lot of these factors kind of interplay is you got these stress, or what would be called oxidative stress. So it's kind of depleting your body. And then what you put into your bodies is really what's kind of counteracting a lot of those things. And that's in itself why diet is so important for stress, or why sleep is so important for stress, and vice versa. And honestly, all these things kind of feed on each other. And again, that's where, you know, testing and things like that is so important. That whole initial phase of playing detective. If we don't know what's going on, it's going to be like throwing darts at a dartboard. I mean, you can get great results, but you need to know what directs your treatment. And again, that's one of the great ways why I love pairing with functional medicine. Even for what I do. This is, again, it kind of helps get a lot of those sort of answers.
Yeah, absolutely. So as far as treatment goes, always starting with foundational things, daily habits, again, never having to do a 180, but just like moving the body, starting to find like, where do we need to start moving the body in the right direction? And then, we start kind of adding more to that puzzle. So again, things like nutrient deficiencies, vitamin C, zinc, B vitamins, magnesium, like things that run a lot of metabolic pathways within the body, a lot of metabolic processes. And, zinc, vitamin C, imperative for tissue, but also testosterone production. So the thing is, like, if we are looking to become more vitalized, we need to make sure we have enough of these nutrients from either diet, supplements, or a combination of, because it's going to be very, very difficult to get your testosterone back up, even if like you're exercising, you're sleeping well, if your body's depleted of C and zinc. And again, I keep saying it again, but like, there's not one variable, as you'll see. Like it's not one thing that causes these types of things. Adaptogens I use quite frequently in practice, and again, they help turn off the nervous system. They can help promote sleep, but the goal is trying to get your body into that routine. Use the supplements to help get your body in the routine, and then after a few months, if we're starting to fall asleep, stay asleep, we're feeling a little bit more, calm, relaxed might be a way to put it throughout the day. We can start backing off on those things. But examples might be ashwagandha, L-theanine, phosphatidylserine, maca root, ginseng, things that have been shown to really modulate specifically cortisol within the body, because that is the goal. If testosterone's low, there's usually something going on with cortisol. Along those lines would also be DHEA. DHEA is our longevity hormone, our libido hormone, and when the body's been under stress for a long time, we usually see DHEA start to deplete. It's not always my first line treatment, but it is very, very effective for boosting testosterone if necessary for a few months. And then, other things, again, like might be some dietary changes, might be increasing fat, might be switching up proteins, might be doing some detoxification practices. I talked a little bit about toxins out of the gate, but toxins are things that it's impossible for us to not be exposed to. But for some of us, we really build these things up in our body. And specifically for prostate-based issues, I've seen toxicity be a big part of what's driving their symptoms, but also where we see relief is starting to help the body get rid of some of this stuff. If like examples of that might be digestive-based issues, right? We're constipated, we have a bacterial or yeast overgrowth, and that is starting to get into the prostate, causing inflammation. Heavy metals, like we're all exposed to heavy metals, but sometimes they accumulate in the body, especially if like every day there's a little bit in our water that we're drinking, or there's a little bit in our deodorant, it starts building up again. Like it can cause irritation, inflammation. So do we need to detoxify heavy metals from the body? Do we need to get rid of this bacteria and yeast overgrowth? Do we need to get rid of this mold? Again, it's not all these things, and it's not always all these things for everybody, but that's the things we start to think about. And then some of the other more specific treatments I might do is, yeah, if one is over converting to DHT and they're having hair issues, they're having prostate issues, well, then we might need to use something to cut down on the conversion. You know, it's called a 5-alpha reductase inhibitor. Natural things might be saw palmetto, nettle leaf. For erectile dysfunction, same thing, stress reduction, vasodilators. So again, all very specific for the individual, but as you can see too, it's about what those root causes are for them. So foundation plus those elements we're trying to put together. And yeah, I think that kind of wraps up some of the more common modalities that I'll do or see.
And yeah, and also to kind of piggyback on that, when we're kind of talking about like toxins and things like that, we are constantly bombarded by various chemicals and things like that. And it's not that our body isn't detoxing on its own, like your liver or kidneys, they're generally going to do a phenomenal job, but you also don't want to overtax those. When you're starting to overtax, that's actually when you start seeing your liver enzyme numbers going up because it's working too hard. And kind of the idea is to offload some of that work that they're having to do and kind of helping to reduce some of that systemic inflammation. And then also to kind of piggyback on some of that as well, we have a lot of hormonally disrupting chemicals that are also, you know, floating through our body. We have, I think that one of the last instances was over 200 to 250, you know, various different types of chemicals that are, you know, surrounding in our body. They're coming from various types of plastics, and many of these are hormonal disrupting. And sometimes that alone can be the cause of you know, low T issues as well.
Yeah, absolutely. So yeah, and again, you talked a little bit about this up front, but that is to the value of integrated care, right? Is that none of us are the end all be all. There is not one best form of medicine out there. It's about keeping all your options open, right? Like if you're having symptoms, where do I need to get started? And sometimes it is just starting in one place. And if you plateau, looking to another. But you know, that is what we value here, is really trying to say, hey, like if we're not seeing the progress that we anticipated with the data that we have, like what are we missing, or where can some further insight be? So yeah, I think I don't know if Dr. Kaelin, you want to wrap up with anything, but I think it'd be a good time maybe to jump into some questions.
Well, sure. I'll go ahead and also kind of piggyback a little bit, since you've talked a little bit about how functional medicine kind of works, testing, and kind of gives a lot of that kind of information. I myself kind of focus a lot on also internal medicine, which is why a lot of the functional medicine and acupuncture, you know, get along really well with a lot of those kinds of factors. What I like to work with, and then how I often see acupuncture helps, is our body communicates with itself, both to your brain, from your brain, and it's doing so through your nervous system, through hormones, and kind of the grand scheme of the small snippet of kind of how that works is to kind of stabilize overall how your body communicates to itself. We essentially have this body map, or your brain knows where your body is. And when things aren't quite functioning right, that's when you have, like with a car, you have like sparks or other things happening. And it's a similar thing with your body. You have these various inflammatory factors. And kind of the idea is to, again, stabilize this nervous system component and also stabilize how the hormones are floating through the body. Because if the body can communicate to itself, it works in an optimized manner.
Yeah, that is a perfect way to put it. Because there are a lot of people that will come in and say, you know, I've been doing this for years, or I used to always do this and it never caused a symptom and now it does. And it sometimes is, it's not always the same thing that works for you for the rest of your life. Sometimes the body's pushed to a certain point where it can't recalibrate itself anymore. And these are the things we're trying to figure out, is like, how can we help with that? So
exactly.
Yeah.
Exactly. And yeah, the body is dynamic. It adapts until you can't. And the thing is, you generally don't see any symptoms until it's surpassed that point. And that's why it feels like it's all of a sudden there's all these processes that have led up to that point. And again, the idea is to nip that before it even becomes a problem.
Absolutely. Foundation. Cool. Yeah, I think Janine, if you're ready, we can open up some questions here.
Absolutely. Thank you so much for all of this great information. Folks, we do have time for some questions. You can go ahead and type them into the Q&A feature on Zoom. We will share that we also offer free 15-minute consultations that are one-on-one time between you and one of our providers. If you do have any questions that are something that you'd like to discuss in private or not in front of a group, you can give us a call at 773-692-6700 or visit us online at alignedmodernhealth.com. We are in network with most major insurance providers, and we also do offer complimentary benefits checks. So if you're interested in some of our services and would like to know what your actual policy covers, you can give us a call at that same number, or again, visit us online at Align Modern Health. We will be sending a copy of this recording to all who have registered. So we know there was a lot of information shared in the last 25 minutes or so. And so if you did want to have a chance to watch it again, we will be emailing it out to everyone a little bit later this week. We do have some questions coming in, Dr. Duro and Dr. Kalin. This first one can go to you both. Is there any correlation between getting or maintaining testosterone levels with body type? For example, somebody with low body fat, somebody with a large amount of muscle mass. Is there any correlation there between body fat, muscle mass, and hormones?
Yeah, honestly, absolutely. That's one of the things that can potentially cause some of these inflammatory factors is having a lot of fat, especially fat around your internals, your visceral fat. And one of the main factors of how it can cause some problems is it can be hormonally disruptive. And fat also kind of drives a lot of these kinds of things. Not that it's bad, it's necessary for your hormonal function as well. But again, it's that whole balance aspect.
Yeah, and along those lines too, I mean, if there is increased adipose tissue, there is note of increased estrogen production. But the other thing too is, and I know this isn't necessarily the specific question, but there are known different body types, right? Like what we call in conventional medicine, the ectomorph, the endomorph, mesomorph, or obviously Ayurvedic medicine had different terms for that. But what's different about those is like, there's one, the ectomorph, that's a little bit more like thinner joints, less stress resilient, usually more sympathetic dominant. Usually I'll see more prone, like those are the typical kind of like hard gainers, right? Like that do usually have higher cortisol, maybe a little bit lower testosterone, need more sleep, do better with yoga, do better with, body weight exercises, things along those lines. Whereas like an endomorph, like those are patients I usually see are like thicker, thicker bone structure, do better with a little less sleep, a little less calorie. Like it's no body type is better or worse. It's just like your body type is what it is. And it's just about like doing the detective work to figure out for your body type, like what type of exercise, what type of diet is best to support that. So, and wish that there was one easy answer for that. But I mean, there is, yeah, that definitely will have an impact.
Thank you both for that information. We do have a few more minutes. If anybody else does have any questions, please go ahead and type them into the Q&A box now. Again, we will be sending out a copy of this recording to you. You can watch on demand at your leisure, and you can always visit us for more information, including past webinar topics and a variety of different blog topics on different wellness hot topics at alignedmodernhealth.com. We'll give folks just another moment to type in any questions they have. In the meantime, again, thank you all so much for joining us. Our next digital doc webinar will be on July 13th, taking a little break for the 4th of July holiday, but we'll be back on July 13th for a stress management topic, an interactive webinar on breathing techniques and guided meditation for stress relief. So you can register for that on alignmodernhealth.com. Here's another question that came in. If someone has a family history of colon cancer, how early should or can somebody get tested or screened?
Yeah, I mean, it depends on what screening or testing might look like. So, and also depends on the family history, right? Like there are some doctors that will recommend maybe in early 30s start colonoscopies, and colonoscopies are very, very insightful. But other markers too that we pay attention to anytime a patient that comes in with family history of that and they're looking to screen or have chronic digestive based issues, another marker that you can use are things known as Calprotectin and Lactoferrin. These are markers that can be tested in stool, and when they're elevated, they themselves necessarily don't diagnose one disease per se, but if they're elevated, there is a very high likelihood that either ulcerative colitis, Crohn's, or colon cancer is either at play, or there's the early levels. Because like we said, inflammation is the cause of these things. So it's determining inflammation within the colon itself. And again, it can be very beneficial with that and a colonoscopy, because it's not going to tell you if you have a polyp or ulcers or anything like that. So sometimes the combination of those two things can be really beneficial.
Thank you so much for that answer. I believe that does take us to time for today. If anybody has additional questions, you can always give us a call or schedule one of those free consults. Again, thank you so much for joining us here at the Aligned Modern Health Digital Doc Series. Thank you, Dr. Duro. Thank you, Dr. Kalin. We really appreciate you sharing your wisdom and expertise with us today. Thanks all. Have a great day. Cheers.
Bye.